Morning, Christine.
Morning.
How are you?
This video will show the journey of a patient who has come in for total knee replacement surgery. They are being greeted by their surgeon and the anaesthetist. You will be given a specific time to arrive for your operation. It is important to follow the instructions about fasting times, when to stop eating, and pre-operative drinks. You can continue to drink sips of water until your surgery. Bring an overnight bag in case you are not able to return home the same day. The person dropping you off will not be able to stay with you, but they can come back after surgery.
Morning.
Morning.
I'm Jana, I'm one of the physiotherapists here. What I've come to go through with you is I've got some crutches that I would like to measure up.
Once the spinal anaesthetic has worn off, a member of the therapy team will visit and get you up and walking with the correct walking aid. If you can mobilise, we will walk you round the anaesthetic room. In most cases, you'll be given a spinal anaesthetic. You will have a cannula in your hand or arm for additional medicines. A spinal anaesthetic is administered via an injection of local anaesthetic in your lower back around the nerves. This is the preferred anaesthetic as they reduce the risk of developing blood clots and bleeding. They help with a faster recovery and give improved pain relief. You will be numb from the waist down and awake for the surgery, and the anaesthetist will ensure you are comfortable throughout. Where a patient is unable to have a spinal anaesthetic, the anaesthetist will discuss a general anaesthetic.
Right, ice lolly again. All the same? Yeah. How about down here? Different? Different.
You will then be wheeled into theatre. You will not be able to see the operation.
Christine, are you comfortable?
Absolutely.
Are you warm enough?
Really nicely warm.
Consider bringing a device and headphones to listen to music during your operation. Some people prefer to have a small amount of sedation to help them feel relaxed. The anaesthetist will discuss this with you. It is normal to have several people in the operating theatre.
How's it going?
All good. All good.
The operation typically takes about 1 to 1.5 hours, and the anaesthetist will monitor throughout. A joint replacement is major surgery. After the operation, once your feeling returns, you'll be given regular pain relief. The pain after surgery will be different from before. We will give you medication to manage the pain for the activities you need to do, including all your exercises. Don't wait for pain to become an issue. Take regular painkillers to keep on top of things. The pain will decrease over time as you heal. Doing the prescribed exercises and mobilisation will help ease the pain and stiffness.
How are you feeling?
Not too bad.
Good.
Actually.
Let's have a quick look at things. So can you show me? You're showing me already. You're wiggling your toes really well. Do you want to try and lift your heel up in the air? See what you can manage. And you can lift your leg. That's fantastic. And do you want to try bending up the knee a little bit? Well done. We like to give patients a spinal anaesthetic because they recover a little bit quicker from it. Is that painful?
I can feel.
You're aware
I can feel
of
it, but
something
it's
there.
not.
Good. That's brilliant.
I feel great, actually. Yeah, I feel I can move my legs. All my feelings coming back. All in all, it's been a really good experience. I was quite nervous about being fully awake, but actually it was good. I could hear what they were doing. Mr. Brian Evans was explaining what he was doing, and yeah, totally great experience.
Regular use of ice therapy or a bag of frozen peas over the surgical area is highly recommended and is very effective for pain relief. You will be wearing foot pumps when you return from theatre. These inflate and deflate to reduce the risk of a blood clot. The staff will assist you with putting these on and off during your admission. Even though you may not be in pain whilst resting, as soon as you start to move and walk, you may experience more pain. You will need to take more pain relief before activities, such as showering. You will be on anticoagulation, blood thinners, for 14 days following knee surgery and 28 days after hip surgery. This reduces your risk of developing a blood clot or deep vein thrombosis, whilst you are less mobile following surgery. This medicine will be provided for you by the ward on discharge. You will be prescribed laxatives to prevent constipation. Please take these regularly until you are only taking paracetamol and the anti-inflammatory medication.
How are you feeling?
All right.
We'll get you to do your exercises and then to get you up and walking if that's okay.
A therapist will come and go through your post-operative exercises and assess your mobility and transfers. In most cases, they will aim to get you up and mobile within 1 hour of you returning to the ward.
It's surprising how quickly you get moving though.
The ward staff are all competent with mobilising patients post-operatively and are able to assist you as required. If you have steps or stairs at home, the therapist will assess to ensure you are safe. During your admission, you'll be reviewed by advanced clinical practitioners. They are highly trained healthcare professionals who can assess, diagnose, prescribe and manage your treatment, working closely with the surgical team. This means that while you may not always see a doctor, you will receive expert care from experienced practitioners who specialise in joint replacement recovery. We aim for you to be discharged on the same day, so please ensure you have arranged transport prior to your date of surgery.
How's it all feeling?
Brilliant. I can't feel anything at the moment.
That's fantastic.
You will be given your medication prior to your discharge. If you have any questions once you return home, you can find contact details for the ward and therapy team at the back of your information booklets and on your discharge summary.